What are your ideas to improve Canada's healthcare system?
Just entice doctors to come into the country. Yeah, that's it. Just get people, professionals here, give them incentive. Yeah, again, affordable housing is linked with that as well. Everything goes back to affordable housing, essentially. So, yeah, I think.
We need more doctors. That's the big one. And we need to be more accepting and recognizing of people's education from different countries as being valid, and not being so critical, because there's my wife's from Mexico, so we see that in Mexico healthcare is more readily available and people get what they need quickly. And here my mother waited 2 years for her knee surgery, and as a result had back issues, hip issues from all the time she had to wait as a result. So we can improve on that.
So I think we should invest in students. There should be more medical schools in Nova Scotia. There should be more in New Brunswick. I know New Brunswick only has one, and that's part of Dalhousie's medical school. So yeah, more medical schools. There should be more doctors, internationally trained doctors here in Canada. They're not able to get their licenses, from what I've heard. And these are some aspects that we can, fund healthcare and improve it, as well as, investing in research, investing in medical research. It's a long-term investment that could reap rewards in the long term, and it will put us ahead in terms of world healthcare.
Oh, now there's the trick question. Okay. Whoever solves it is going to be a hero, because they're going to bring peace to our health crisis in the system. I think it needs to move from underneath the management of the provinces to a global medical system, so that doctors and nurses and resources, the important stuff that takes care of people, that those people can move from province to province and go to where they're needed most.
Well, for starters, we need to bring in more doctors and make it more something that they want to come to, as opposed to all of our doctors going to the States, paying the nurses. We have enough facilities. We're from Alberta, and we do have the facilities. We just don't have enough people that actually can utilize it to give the public the services they need. We don't need to wait 6 months to a year for cataract surgery.
Infrastructure and nurses and doctors, incentivizing those types of jobs.
I know that they do have a lot of incentives put in place to get nurses and doctors to stay, but it doesn't seem like there's so much strain on the healthcare system right now. And they're pumping out so many new students and stuff like that, but nobody seems to want to stay here, and I'm not sure what it is they'd have to do to get them to stay, honestly, because I'm in the healthcare myself. I'm a PCA. And it just seems like there's not enough staff to patient ratio, so you can't really give proper care.
I think it's different in every province, every jurisdiction, but I believe that if money is going to be well spent in our healthcare, our provincial government has to look at what exactly the needs are and do more of an analysis rather than a shotgun approach in spending.
Privatize healthcare, I would say.
Why?
Because if you go anywhere that's privatized health, that's where you go. Like, if you have something really wrong with you and we're not getting dealt with here, which is most of the time, you go somewhere where it's privatized and you get the care you need. You know what I mean? Like, if you go to the States, a lot of people go to the States now for health care, and they just pay out of pocket for it because it means they're getting the care that they need and they deserve. And
I think we need to do better on wait times. I think we need to do better on recruiting, getting doctors, getting nurses in rural Newfoundland. I'll speak to rural Newfoundland, or Newfoundland in general. We have a major issue getting doctors, keeping doctors in rural Newfoundland, training more nurses, making it more readily available, more cost, making it more affordable for young people to get into the nursing and into the doctor profession. So definitely I think we need to certainly concentrate on the healthcare and spend more money recruiting and keeping a continuous, as someone graduates, a doctor graduates and goes into practice, there's someone else coming right behind him.
People who want to go into the medical profession, they shouldn't have to pay for their education as long as they work in that profession for a certain length of time.
We also need better hospital capacity. The regional and federal governments have been too stingy for too long, and now it almost looks as if there's nothing to be done about it.
Stop paying for travel nurses and just actually pay the nurses that we have a decent amount of money so they don't leave and come back through the travel program, because that's what our government is forcing them to do. We're not nurses. That is a non-biased opinion.
Sounds reasonable to me, yeah.
One small idea, minor, but I think could have an impact, is allow retired doctors to come back to work. There's a lot of retired doctors out there that aren't allowed to practice anymore because they've given up their billing number, and they had to, give up that right to practice. But I know personally of some of them who'd be happy to come back for even a few hours a week. And I think if a few hours a week for many of them gave them, not a purpose, but motivated them, they wanted to do it and they're willing to help, then why wouldn't we allow them to help? And I think that's something that's so simple to fix here in New Brunswick and just hasn't been looked into.